Tonight, we are learning that more children are becoming infected with COVID-19 as cases continue to rise in Chatham County.
The Coastal Health District says cases in kids ages 0 to 19 have increased more than 300% over the last 2 weeks. And WSAV News 3's Brian Ray is joining us now live from Memorial Health with our top story.
Tina and Ben, I'm told 5 children are currently admitted at Memorial Hospital with COVID-19 out of 108 total COVID patients. This is an increase from last month's average of 0 to 1 pediatric patients. Doctors say the highly contagious Delta variant and unvaccinated adults are likely causing this increase. Dr. Stephen Thacker says kids are carrying the virus at a greater rate than earlier in the pandemic.
When we think about what's made this variant different than the ones before is its ability to infect. It's easier at infecting us, and it makes a whole lot more copies of itself. So the amount of virus in people, whether they're vaccinated or not, is high.
Dr. Thacker says the majority of kids with COVID have underlying conditions or are not vaccinated, even if they're eligible.
We're recognizing that many more children were infected with the prior variants of this strain than we realized. It's just they didn't have symptoms. And so I fully expect that there's going to be children who are infected that are going to have little to no symptoms. Many of them will have very mild symptoms.
Leaders at Memorial Health Children's Hospital say the hospital is at capacity but not out of beds. The hospital is also seeing an increase in other illnesses like RSV.
We have been very fortunate in the fact that we have not run out of beds. We are planning, just like we would with any other surge in patients, if we ended up needing to go to another location for patients, what would that look like?
With many kids returning to the classroom, Dr. Thacker says time will tell if schools are a source of community spread.
Every school system should be looking at every strategy that helps keep them healthy and well in the school, and that includes masking, and it includes listening to the guidance from the CDC or your partners at the Department of Public Health on quarantining.
Hospital leaders are encouraging parents to get vaccinated to slow the spread to children.
Look, just because your child can't get vaccinated, you absolutely still can, and that is a method of protection to your child who has not reached the 12-year-old mark yet.
Dr. Thacker says if your child has a cough, sore throat, or runny nose, you should speak with your primary care doctor about getting them a COVID test. He also estimates the FDA may fully approve the vaccine for kids under 12 at the end of this year. Live at Memorial Health, Brian Ray, WSAV News 3 on your side.
Brian, thank you.